Welcome back to Catalyst University. My name is Kevin Tokoph, and in this video, we're going to be discussing strengthening of the TMJ, so strengthening of the mastication muscles. Now, mastication muscles, there are 4 of them that control the TMJ. Those are the temporalis, the masseters, and then internally we have the medial and lateral pterygoids, which you can palpate indirectly via inside the mouth. And they are all innervated by the mandibular nerve, trigeminal nerve branch 3. Now, when we are strengthening these muscles, we are not strengthening specific muscles. We are strengthening movements, because each mandibular movement, each movement of the TMJ has contributions from at least 2 or 3 of these muscles in different proportions. So you can't isolate the lateral pterygoid. You can't isolate the temporalis. But what you do instead is you strengthen the movement. And when you strengthen the movement, the muscles will also strengthen. Now, there are 2 major types of strengthening exercises we can do for the TMJ muscles. Number 1, isometric strengthening. This is what you see in the vast majority of clinics all over the world. It's pretty standard. Most people will do it at some point in their career if they treat a TMJ patient. The second type, which is not commonly done, but could actually benefit some types of patients, is dynamic strengthening. So actually where you're strengthening through range of motion. Kind of the equivalent of here's isometric bicep and then doing it with a bicep curl, okay? Isometric versus dynamic. And yes, you can do dynamic strengthening on the TMJ. There's just some ways that are better than others. Now, with strengthening the TMJ, first of all, most TMJ patients don't actually need strengthening exercises for the TMJ. They may need it for the scapular muscles, they may need it for the deep neck flexors and other cervical muscles, as we've talked about in other videos, but it's not as common they need it for the TMJ. However, if there is a weakness on one side, a profound weakness of one of the muscles, that could very well be contributing to their symptoms, and we want to strengthen that. And the go-to for most people is isometrics. Now, when would be the indication to use dynamic strengthening instead of isometrics? Well, first of all, not everybody likes isometrics as much as others. Some people just don't really tolerate them that well. But if you provide a little low resistance from, let's say, a band, which I will show you throughout this video, some people tolerate that a lot better. The other thing I want to point out here is, unlike most joints, the TMJ doesn't really function isometrically. I mean, think about it. If you stand up, your glutes are functioning isometrically, your quads are functioning isometrically, your core is functioning isometrically. But think about the TMJ. When does it really function isometrically? I mean, I suppose if I just hold this position, there's probably a little bit of, tonic activity in some muscles, but think about how many times a day you move your mouth. I would venture to say the vast majority of Americans probably move their mouth more times a day than they actually take steps. Let that sink in for a second. I have never seen a study that has shown that, but I would guarantee most people move their mouth more than they move their legs. It's a very dynamic joint. So does it really make sense to stick with isometrics there? And I'm not suggesting that you try to do a bridge from your jaw. No. But some people may actually benefit more from dynamic strengthening than isometrics. And a lot of times you have to just ask your patient. Maybe they tolerate isometrics fine and they're responding well to it. So keep those. But some people may not like isometrics. So switch over to dynamics and give those a try. And in this video, I'm going to show you how to do isometrics and dynamics for every single movement of the TMJ, at least the ones that are common to use in the clinic. The first movement we're going to look at is mandibular protrusion. Now, just as a review here, remember the movement of mandibular protrusion is literally protruding the jaw forward like that. And so if you want to strengthen that isometrically, well, you're just going to resist that with your hand. Now, that might seem obvious. However, one thing I commonly see with this is people will do 2 fingers. You're not getting anything with that. I see that on pictures, HEP to go, some videos on the internet. Protrusion, even if you have a little weakness in there, it's a really strong movement. You're going to need to use your fist and potentially even reinforce that with your other hand. You're going to have your mouth slightly open. It's never closed. We need a little bit of space in that TMJ. So a little bit open and then resist. Do that again. And normally, I'll have people start with 10 to 15 repetitions, 5-second holds. Let's now take a look at the dynamic version of strengthening mandibular protrusion. So, dynamic strengthening of mandibular protrusion. What do we need for it? Well, we need some kind of elastic band. And my preference is to use a monster band, aka pull-up band. And we're going to have it anchored around something really sturdy, like a squat rack over there. And it really should be anchored slightly above jaw level. Now you say, really? A resistance band? We're just doing the jaw muscles. But these muscles are deceivingly strong. So most elastic bands, like a TheraBand that's provided by most clinics, even the darker, stronger bands may not actually be strong enough to really get the benefits for some of these movements like protrusion. So what we're going to do is we're going to face away from the anchor point, and we're going to put this around the front of the jaw, making sure it's not on the teeth. Now, these fingers right here, I'm going to have hooked over on both sides just to control the band, but they're not assisting. I'm trying to put as much of this as I can in the mandibular protrusion muscles. Now, when I'm doing this, I'm not forward like this. Remember, we're trying to correct against cervical protraction, kind of keep those good postural mechanics. So I'm actually going to gently engage the cervical retractors, meaning the deep neck flexors. And then I'm going to protrude against this band resistance. Making sure to control it back each time. The second movement we're going to be looking at is mandibular lateral deviation, aka lateral excursion. Now, in terms of active range of motion, it just looks like this. Jaws moving side to side. So if we want to perform isometric strengthening of the lateral deviators, we need to just resist the movement. Again, the problem I see, people are using 2 fingers. I know for a fact on HEP to go, the picture shows this. These fingers, for the vast majority of people, I can't think of one person where this wouldn't be the case. This is not enough force. You're not going to really get any meaningful gains unless you add a little bit more force. Plus, your fingers, they bend. Like even if they just do this, right? This is not the best way to go about it. You're going to want to use, again, your fist. And you're going to have your mouth open just a little bit and then resist. And then we'll switch sides. The fist, and maybe you want to put a little towel around it so it's not your bones on there, but that is a much, much better way to strengthen the lateral deviators. Now, I suppose if it's really painful, you might just consider using a couple fingers, but that would just be more for more pain control isometrics. If you actually want to get these muscles stronger, it's got to be the fist or something like that. Fingers aren't going to be sufficient for that. So now let's take a look at how you would strengthen that dynamically. Now, dynamic strengthening for lateral excursion, aka lateral deviation of the jaw. So for this exercise, we're going to set it up exactly the same way we had for mandibular protrusion. We've got a monster band like this, wrapped around something sturdy like a squat rack, but this time we're going to be facing perpendicular to the band. What I'm going to do is get some good tension on it, wrap it around the back of my neck/head. I'm going to switch hands here, and then I'm going to very carefully drape this across my mandible. It's not across the cheek because it's the mandible that's moving. So the resistance needs to go across the mandible like this. And as it stands, this is pushing my jaw into left lateral deviation. So the resistance I'm going to be performing is into right lateral deviation. So that will look like this. Now, some people might be a little bit apprehensive with this movement. So what you want to educate them on is instead of starting over here and crossing midline over to the other side, just begin in midline and do basically half reps. So that would look like this. And then, as it becomes more tolerable, allow it to cross midline. But these exercises should not be painful. Now, the third movement we're going to be looking at is mandibular depression. Now, mandibular depression is the one movement where there's only one real TMJ muscle that is contributing to this, and it's the medial pterygoids. There are, however, other contributions, one from gravity. Like if you just 100% relax, like no activity, it opens a little bit. That's just gravity. If I want to open further, it's going to be medial pterygoids and then several of these infrahyoid muscles that are not TMJ muscles, they're not mastication muscles, but they do assist with that movement. Okay, so this is the only movement where there's only one TMJ muscle that is explicitly involved in the movement. But again, if I want to strengthen this, I'm just going to put my fists under here and resist mandibular depression. Again, starting with my mouth open just a little bit. The other thing you want to make sure to do with this exercise is don't be doing it in this position here. That's going to put more load on the jaw. Make sure when you're doing this, you're sitting up fairly tall because we don't want bad posture. That may have been part of what contributed to the TMJ issues in the first place. So have slight cervical retraction, keep the shoulder blades back a little bit, and then do it. Okay, there's mandibular depression isometrics. Let's go now take a look at the dynamic versions of that movement. So for dynamically strengthening mandibular depression, we need to change our setup just a little bit. We're still going to be using an elastic band like this, but the anchor point, as you can see, is directly above me. And the reason for that is we're going to be putting this under the chin and then resisting. So we want the mandible to be moving against that band resistance. Now, there's basically three ways you can do this. You can do this directly under it. You can come forward, or you can step back so you're more behind the anchor point. The latter is the best. The further you are in front, actually, the more likely the band is to slip off. And it has to do with the angle that the mandible actually comes down at, particularly when it's coming back up. So you're much less likely to have this fly off if you actually stand behind the anchor point. So what I'm going to do is take a step back here, get a little staggered stance, put this here. I'm going to use two fingers going around the band here just to stabilize. And then I can even add a little more resistance by tugging on these. And then I'm going to perform mandibular depression. Now, this would be a great exercise for somebody who is really in functional optimization for neck and TMJ cases, where you've already eliminated the deviations and deflections, but you still want to make sure the person's not deviating or deflecting their jaw as it comes down and back up. So it's a good idea if you're doing this to have them do it in front of a mirror or set their camera up so they can actually see how their jaw is moving when they do this exercise. Now, the fourth movement we're going to be looking at, which is going to be very brief here because there's really no dynamic way to strengthen this effectively, mandibular retrusion, aka mandibular retraction. So for retraction, all of the muscles that control this are contributing to these other movements. So if you're strengthening the other movements, you're still strengthening all the muscles that control retrusion. So presumably, retrusion should increase in strength with the other movements. I can't think of a single case where I've actually had to strengthen retrusion. However, If we did, for whatever reason, need to do that, maybe it was a motor control issue or something like that, the way we would do it is first understand we would need to actually start in a slightly protruded state, like this. And then the movement is we bring the jaw directly back, like that. So the way we would strengthen that is we would, one, make sure our fingers, either one or both of these, are clean. And we're not going to put it on the behind the teeth. We don't want to knock teeth out. We're going to put these on the floor of the mouth. Maybe just one here. And then retrude. Now, you're not going to be able to apply a huge amount of force with just a finger doing that. But that is probably the best way to do that movement that I know of. Not many instances where you need to do that, but it's there if you ever did need it. Now, the last movement we're going to be looking at is mandibular elevation, so closing. Now, with closing, the best way to strengthen this, if you ever had to, is just by biting down on something. Now, you obviously can't do that with your fingers because you might bite your fingers off. So there's a couple of ways you can do this, both isometrically and dynamically. One way is with some kind of jaw strengthening exercise. Here's one example right here that you can see on the corner of my screen. This is just from Amazon. I actually have a pair of these. And you basically just put them all the way back between the molars on each side. And then you just bite down. You can do both at the same time, or if, let's say, which I have run into, a patient with very weak masseter on one side, just put one in on the side of that weak masseter and bite down. And just do isometric sets, so 10, 15 repetitions, holding 5 seconds each to start. And you can gradually build up from there. And no, biting down like that does not cause TMD. TMD is multifactorial. You're not going to just get TMD by strengthening the masseter on one side. It doesn't work like that. You get TMD when you have significant muscle imbalances and you have weakness in the neck and mobility issues in the neck, the thoracic spine, the scapular region, all this other stuff. Just simply using those devices in your mouth, that is not going to cause TMJ issues. Bottom line. If it did, there's other things that you never addressed that need to be addressed. So now that we've seen an isometric way to strengthen that, and the link to get those will be in the comments of this video, let's take a look at some dynamic exercises to strengthen mandibular elevation. Now this last exercise, dynamic strengthening for mandibular elevation, so basically mouth closing, there's no way around it. It's honestly a ridiculous looking exercise. Some people might say it's actually a stupid exercise. However, when you do this, and if you do it consistently, maybe a couple times a month, over a few months, you will notice that your jaw muscles, particularly the masseter, feels a lot stronger. Now, what I have here, got the squat rack, I've got the monster band here. I have it anchored low because it's going in our mouth. However, we're going to use a towel or a washcloth, and we're going to wrap it around the band here. And it is a clean towel. Emphasis on clean. Make sure it's clean. What we're going to do here is we're going to put this in our mouth, not in the front, not around the incisors of the canines. Try to get it as close to the molars as you can. And then you just allow your mouth to open to some extent with control and then close. Allow it to open with control and then close. It'll basically just look like this. If I wanted to add more resistance, I could literally just stand up while I'm doing this. I'd probably take this out of my mouth first, then stand up, then put it back in and repeat the same exercise. Again, it looks absolutely ridiculous. And it honestly kind of is. However, it will actually give you a lot of gains in strength in your masseters, which in turn can actually help reduce the incidence of TMJ issues later on, as more of a primary prevention type of situation, or again, as part of the functional optimization that we would have at the end of somebody's plan of care. So when you're differentiating between using isometric strengthening or more dynamic strengthening, it really just all boils down to your patient. What do they prefer? Maybe one is more tolerated. So bottom line here, when you're choosing to strengthen isometrically or dynamically, it boils down to a number of factors. One of them is simply what's better tolerated. Maybe isometric is not tolerated very well, but dynamic is. Or maybe it's vice versa. A lot of it just simply boils down to your specific patient. This is patient-centered care, right? The other thing is, if by chance you have a situation where somebody had a TMJ arthroplasty, or maybe they had a dislocation of the jaw. I've actually seen one of those. Somebody had a dog jump up, knocked the jaw, came out of place. Had to go to the hospital, relocated it. Now they were in physical therapy. Well, we actually did some dynamic strengthening there. Isometric was not sufficient. We eventually progressed into a dynamic and they eventually got better and we're fine, discharged. So a lot of it is just decision-making based on your patient. But there may be cases where you'd like to try dynamic strengthening if you've never done it before. Sometimes it feels actually a little better than isometric because our jaw was meant to move. So please make sure to like this video, subscribe to my channel, and hit that notification button for notifications for all videos in the future. Thank you so much.